is Dr. Calliope. I'm going to be performing your examination today. How are you doing today? Oh, okay. Well, we will have to have a look at that. Interesting. Let me just write that down. So, we've got you coming in for tingle immunity, huh? Okay, well, we may have to switch gears then. Let's just get some preliminary information down, alright? Okay. Can you give me your name, please? And your date of birth? Excellent. And what is your preferred name and address? Okay, that's wonderful. So, tingle immunity, huh? Alright, let me just jot that down, and we've got a very special way that we like to conduct our tingle immunity examinations, alright? Okay, let's go ahead and just start there. So, are you currently having any pain or any discomfort at all? Any sort of illness? Okay, and any changes to your medical history that we have on file? No. Okay, that's great. And no serious illness within the past 6 months or so? Alright, that's excellent. And what about your family history? Any changes to that at all? No, that's excellent. Okay, what about your allergies? Any new allergies at all? Alright, didn't figure, but we gotta ask. And what about your medication list? Is it still... Let's see, I've got a couple on file here. Is that... Okay, we need to change some things. Alright, so what are you taking now? Okay, and how big is the dose? And how many times a day do you take that? Okay, that's excellent. And the next one? Okay, and the dose? Ooh, not sure. Okay. And how many times a day? 4 times a day. Huh. Interesting. Okay, let's go ahead and move on. So, I've got some tingle immunity questions for you that are specific for tingle immunity examinations, alright? What kind of ASMR do you generally watch? Okay. Alright, so a little bit on the soft and slow, have done a little fast and aggressive once in a while. Okay, that's excellent. And any particular triggers that really strike your fancy? Medical role plays. That's excellent. That's one of my favorites as well. And how often do you watch these ASMR videos? Okay, that's kind of a lot. Alright. So that might be our first inclination that you are having some true tingle immunity. Alrighty. And when did you first notice that you started having the immunity to the ASMR tingles? Okay. Alright. And is this a full immunity, or is it just not as sensitive? Are you still getting tingles, or is there absolutely no tingles whatsoever? Okay. No problem. And have you ever had tingle immunity before? And how was that treated? Okay. Did they come back, the tingles? I assume so, since you've had it again. Yeah. Okay. That's excellent. So let's go ahead and proceed to the examination. I'm going to pop on some gloves. Let's see. Got some gloves. So for our examination today, I am going to need to be touching you. Is that okay with you? Do I have your permission to do that? That's wonderful. Excellent. Please let me know if at any point you feel any pain or any discomfort, okay? Your comfort is number 1 here. Alrighty, so we are going to be conducting a full body examination for your tingle immunity, alright? So triggers may be a little intense, they may be a little fast or aggressive. The main thing is we want to change how you usually see ASMR, either discovering new triggers or discovering new people or new ways of doing things, or even just speeding up or slowing down what you usually see can sometimes do the trick, okay? Alright, let's go ahead and start on your head, alright? So, I'm just going to come in and I'm going to start feeling on your head, okay? Have you noticed any pain or itching or swelling, irritation, anything of the sort on your head? Okay, any issues with the hair at all? Okay, and no unexpected dryness or oiliness in the scalp? Okay, very good. So, your head feels like it's got all the lumps and bumps that it should normally have, so that's really good. So I'm just going to keep following this down. I'm going to come to the back of your head, back of your head, back of your head here. Okay, I'm just feeling the occipital lymph nodes back here, back here, back here, back here. Okay, I'm just going to come down along the neck here. Let's see. Let's feel that. So the lymph nodes feel normal. There isn't any distension, which is really good. And you said you haven't had any infection or any sort of illness lately. Okay, I'm just going to feel down your jaw here, submental, submandibular, lymph nodes, very good. I'm just going to feel by your ears here. So we're going to do the preauricular, the postauricular nodes rather. Okay, nothing there. All right, that's very good. So your head looks to be symmetrical, and I'm not seeing anything out of the ordinary. Okay, very good. Let's take a look at your face, okay? Have you noticed any sort of issues with your face, whether it be with anything that is on your face or your skin? Any issues with your eyes, your nose, your mouth, your ears, or the skin? Okay, not particularly. That's very good. I'm just going to manhandle you all over here, okay? Just going to have my hands all over you. Alrighty? Very good. Okay. So the eyes look clear and alert. That's really good. And can you just tip your head back for me? Okay, so on initial examination, your nose looks really good. You can go ahead and put your head back down, and we'll take a little bit of a better look at everything in just a few moments. So I'm just going to press around on the muscles on your face. I want you to let me know anything is painful, feels weird, any discomfort, okay? So I'm just going to palpate the temporalis muscle here. Any pain, any discomfort, any weirdness? Nope, okay. What about the masseter muscle here? Anything weird? Nope, doing all good. Okay, that is great. And can you feel all this sensation? Okay, there isn't anything that you haven't been able to feel so far. That's excellent. Can you go ahead and just clench your jaw for me? And open your mouth. And clench your jaw. And open your mouth. Okay, very good. And clench your jaw. Open your mouth. Clench your jaw. Open your mouth. And you can go ahead and keep your mouth shut. That's excellent. So it doesn't look like there is anything out of the ordinary there. Let's go ahead and take a look at your eyes, okay? So I'm going to come in real close. Real close, okay? I'm just going to take a very, very, very close look at your eyes here, okay? Have you had any trouble with your vision at all? Any changes? Any double vision? Anything of the sort? Any sudden blurriness? Nope, we are doing all good there. That is excellent. So let me go ahead and grab a pen light. Alrighty, we got a pen light here. And I just want to take a look at your eyes. You don't have to do absolutely anything. You can look straight ahead. I just want to take a little look. Okay, little look. Alright, I want you to go ahead and follow the light for me, okay? Using only your eyes without moving your head. We're going to go a little quickly, so let's go over here, up here, down here, and over here, up here, down here, over here, up here, down here, and over here, up here, down here, and back over. Let's go ahead and go up. Let's go down. Let's go to the side. Let's go to the side. Okay, let's go up. Let's go down. Let's go to the side. Let's go to the side. Excellent. Let's go diagonally up. Let's go diagonally down and diagonally down and diagonally up and diagonally up. Let's go diagonally down and diagonally up. Excellent. I want you to keep following this light. I'm going to bring it in really close, really close, really close. And let's go far away. Keep your eyes on the pen light. Very good. And we're going to go in. Very good. And back out. Wonderful. Keep going. We're going to go in and back out. That's great. Let's go ahead and do this on the other side. We're going to move very closely inward and in and out, 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 out. Very good. And in and out. Very good. And in and out. That's wonderful. Let's go ahead and check your pupillary response. We're going to do the direct consensual response test. I'm going to shine this light in one eye while I am blocking your two eyes right in the middle here. I'm going to shine the light in this eye. That eye should respond to the light, and at the same time, the other eye should respond at the same time in the same way, okay? So let's go ahead and do that real quick. Just go ahead and look ahead for me, and we're going to go direct, direct, direct response. That's excellent. Consensual, consensual, consensual response. Wonderful. And keep looking ahead for me. Direct, direct, direct response, and consensual, consensual, consensual response. That is excellent. I'm going to do the swinging light test. I'm just going to swing this light back and forth between your eyes. I'm looking for any defects in your eyes at all. Okay, so we're going to swing the light here and back, 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 and back. All right, that looks great. So we're going to do a little finger wiggle test, okay? So I have my fingers up here. I want you to put your eyes gaze on my nose, okay? I'm going to wiggle one finger or the other, and I want you to tell me which finger is wiggling, okay? You ready to go? Let's go. Okay? Good? Great? Yep. Brilliant. Awesome. Okay. And now we're going to test a little bit of your peripheral vision, okay? So I'm going to be bringing my fingers in to your gaze. I want you to keep looking at my nose, and when I bring the fingers in, when you see them come into view, go ahead and tell me, all right? Excellent. Yep. Good. Woo. Nice. Yep. Brilliant. Cool. Excellent. So let's go ahead and do one more test. This time I am going to do a vision test in which I am going to just flash numbers, okay, in your periphery, and I want you to tell me which number you see, how many fingers you see, okay? So for example, this is 1, this is 2, 3, 4, 5, all right? Sound easy enough? Okay, go ahead and keep your eyes right on my nose, okay? Let's go. Good. Yep. Excellent. That's great. So let me go ahead and write this all down real quick. Gotta keep on track. Okay, all good. You have a face, you have eyes. That's wonderful. Let's go ahead and check on your ears if you don't mind. So have you had any problems with your hearing or balance at all? Okay, and any itchiness, any swelling, any redness, anything going on with the ears that shouldn't be? Okay, that's wonderful. So I'm going to grab my little otoscope here, and I'm just going to have a little look, okay? Just a very quick look. Very quick look. Okay. Taking a look in the ear. That all looks great, okay? And I'm just going to take my otoscope out. Very good. And I'm going to check on the other ear. We're going to do just a very quick look. Okay, I can see inside the ear. Everything looks great. You have a tympanic membrane, which is very important, so that looks really good. I'm going to go ahead and take the otoscope out of the ear. Alrighty, so let's go ahead and do some hearing tests, okay? I'm going to do a little bit of a finger rustle test. So I want you to close your eyes, okay? Close your eyes. And I'm going to rustle my fingers on one side or the other. I want you to tell me whether you hear it on the left or the right, okay? Ready? Good. Brilliant. Yep. Wonderful. Great. Yep. Okay, that's awesome. So now I'm going to whisper some words in one ear or the other, and I want you to tell me what you hear, okay? All right. Orchid. Ear. Plastic. Paper. Wood. Cotton. Stack. Cord. Okay, hear all those words? Okay, and you've repeated them back to me. That's awesome. Now I'm going to try to do this with a tuning fork. I want you to tell me when you hear the tuning fork, okay? You can keep your eyes open, you can keep them closed, doesn't really matter. When do you hear the tuning fork? Hear that? A little bit? Okay. What about this? Oh yeah, we can hear that. That's great. Okay. What about this? We can hear that. It's pretty okay. All right. What about that? A little harder to hear. Okay. And how about this? Can we hear this? Okay, we can hear that. What about this? Can we hear this? We can hear that. All right, that's excellent. Let's go ahead and move along. So your hearing is intact. You can hear everything. And let's go ahead and take a look inside your nose, your mouth, and your throat, okay? So I want you to go ahead and tip your head back again. We're going to pop off that speculum that was in your nose. That would be gross. And I want you to tip your head back. I'm going to look inside your nose, inside your nose, inside your nose. All right. Very good, very good, very good. And that looks great. Okay. Septum looks like it is in place. There's no redness or swelling inside of the nose. Have you had any issues with your sense of smell, any sinus pressure, anything in the sort like that? Okay, not really? Been doing okay? That's very good. Okay, let's take a look inside your mouth then. So, let's see, got our pen light, and I've got the world's tiniest tongue depressor. Really, it's quite puny, but it'll do the job. I want you to open your mouth for me, okay? And I'm going to take a little look, all right? Just taking a little look. Okay, those are some really nice teeth you've got there. I do like a good pair of teeth. Pair of teeth, as if you only have 2 teeth. That's a little awkward. Would you mind if I have your teeth? Okay, yeah, that's pushing it a bit far. All right, no matter. And, okay, I want you to go ahead and say, ah. Very good. Okay, I'm looking in your throat and haven't had any issues with allergies, any sore throats, any swelling, nothing like that? Oh, I guess you can't really say anything when your mouth's full open like that. Okay, well, I'm just going to go ahead and take the tongue depressor out. I want you to go ahead and just lift your tongue to the roof of your mouth. Okay? Very good. All right. Oral mucosa looks great. Underneath your tongue looks great. Your teeth look awesome. I'm really disappointed that you won't let me have your teeth, but it's whatever. So you can go ahead and close your mouth then. Have you had any issues with your sense of taste or any issues with biting, chewing, anything like that? Okay, you've been doing okay? All right, that's great. So let me go ahead and see here. You know what I forgot to do? We forgot to get your vitals. Totally should have done that in the beginning. Totally skipped over it. It's whatever. Let's go ahead and do it now. So let's go ahead and grab your temperature. I swear to God that this has not been used on the previous patient before you. And I want you to open your mouth for me, put your tongue to the roof of your mouth, and go ahead and lay that back down. Very good. We're going to wait just a few seconds, and all right, let's see. Oh, that's a little low. Huh, it's a wonder you're still alive. Oh well. Okay, let's go ahead and grab your pulse. So, do you have a preference as to which wrist I use? Okay, let's go ahead and use this one. All right, and let's take your pulse for a moment. Let's see. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Holy snaps. Your pulse is a little high. That's like 110 beats per minute. That's a lot. We're going to have to take a look at that. That might be a little much for what we got going on today. Let's go ahead and take your blood pressure, okay? I'm going to pop my stethoscope in, make sure I put it in the right way, and I'm going to take your blood pressure on the same side that we did your pulse. So I've got the sphygmomanometer, all right? And I'm just going to undo the cuff, put it on your arm, and we will begin, okay? All right, excellent. Is that pretty firm on there? That's good. Okay, so I'm just going to hold the dial, hold the stethoscope to the crook of your elbow here, okay? And then we're going to inflate the cuff. Okay, what are we at? All right, let's go ahead and deflate the cuff a bit. All right, let's go ahead and inflate it again. Alrighty, and deflate the cuff. Okay, blood pressure is a little high. We'll have to keep an eye on that. Alrighty, I'm going to put that down, and I'm going to take the cuff off of your arm. Alright, I'm just going to go ahead and set this to the side. we're not going to need that anymore. It doesn't really matter if it's on the ground or not. Okay, so I'm just going to jot that down, jot that down, jot that down. Wonderful. And your respirations per minute were, they're all right. Go ahead and jot that down. Okay, very good. All right, so let's go ahead and listen to your heart and lungs while I've got the stethoscope in, okay? So I want you to go ahead and just breathe normally for me. No, not like that. Normally. Not like that. Normally. That's how you breathe normally? Oh, buddy. All right. Okay, just do what you will. Okay, well, I can hear you have a heart in there. That's about as far as we'll go. So I'm going to have you take a deep breath in and deep breath out. Deep breath in, 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 deep breath out. Awesome. Okay, so that was pretty good. All right, don't need that for the rest of the deal. Not a big deal. Okay. Very good. Let's go ahead and take a look at your hands, okay? If you could just place them right in front of me with your palms towards the floor, okay? I just want to take a look at the skin of your hands. I want to look at the fingernails. I want to look at your circulation, in which I test the capillary reflexes on your fingernails. That is excellent. You have pretty good circulation. Very good. Can you go ahead and flip your hands over for me? Very good. Okay. Have you noticed any issues with your joints at all? Any sensation? Anything of that sort? Okay. Been pretty good. Okay. And can you go ahead and just show me your elbows for me? Yeah, very good. Okay. Yep. No signs of any psoriasis or anything of that sort. Okay, you can go ahead and put your elbows down. All right, let's go ahead and take a look at your legs and your feet, okay? Have you had any issues with your legs or your feet, whether it be any pain, any discomfort, any loss of sensation, any issues with the muscles or the joints? No, everything's been pretty good. Okay, let me take a look. All right, so I'm just going to look at the legs themselves. I want to look at the skin. I want to look at the muscle. Okay, I want to look if there's any edema. I want to look if there's any lesions. Sometimes you can have lesions on the legs. It's pretty gross, but hopefully you don't have any lesions on the legs. And everything looks good. Okay, so I'm going to take a look at your feet a little bit. If you want to just pull them up a bit for me, that's great. I don't want to bend over too far. I just want to kind of sit in this comfy chair. So, all right, so the feet themselves look great. The ankles are not swollen at all. There's no pedal edema here. Okay, and there's no pitting edema. That's excellent. And I'm going to just check the capillary refill on your toes, okay? I want to make sure your circulation is really good in your feet and your toes as well, okay? And that's looking really good. Overall, I think that's really good. Okay, I'm just going to flex your toes a little bit and just let me know if there's any pain, any discomfort, okay? And you can feel everything I'm doing, correct? Okay, there's no loss of sensation? All right. Oddly enough, funny story, I don't have any sensation on my big toes on the inner third of them, just in this little spot. Nobody really knows exactly what's going on with that. Some people had thought maybe it was an electrolyte issue, but I just lost all the sensation on the insides of my big toes. It's really weird, had it for years, but it's literally less than an inch of real estate. It's not really that big of a deal. But anyway, back to your feet, right? We were talking about you. Okay, so that looks all great. I'm going to have you go ahead and put your feet back down on the ground, okay? And we're going to lastly do a musculoskeletal examination, kind of a balance test, kind of a whatnot, sort of catch-all little deal. So you're going to get up for me, okay? All right, stand up for me. And can you close your eyes and just try to stay in place as best as you can, okay? Okay, very good. And you can go ahead and open your eyes. Can you walk to the other side of the room? A little faster. A little faster. We don't have all day. Okay, can you come back, but this time walk on only your heels. Your toes not touching the ground. Very good. A little quicker, a little quicker, a little quicker. Okay, can you walk back on your toes? On your tiptoes. Tiptoe, tiptoe, tiptoe. Very good. And can you come back walking heel to toe? So your heels are touching your toes, your heels are touching your toes, whatever. And let's keep going, let's keep going, let's keep going. Okay, very good. Can you just go ahead and bend over for me? No, not like that. I want to adjust your spine. Yeah, don't let anybody else use that line on you, okay? I am a professional. I wouldn't trust anybody else, okay? Yeah, alrighty. Very good. Just feeling your spine, feeling your spine, feeling your spine, feeling your spine, okay? You haven't had any issues with any scoliosis or any back pain, have you? Well, I guess everybody has back pain, huh? That's like one of the most common health problems. Back pain, right? Yup. Okay, well, I guess really I'm having a lot of back pain from carrying this conversation, but just be like that sometimes. So you can go ahead and get slowly up. I would slowly lift up. Okay? Don't want all that fluid that rushed down to your head all of a sudden to go everywhere else and you get black spots in your vision. All of a sudden you can see all of space and time. That's a little awkward. Okay, that's all good. Can you lift your arms up for me? Just kind of, just like that. Can you move everything? Move everything all at the same time. Everything at once. Very good. Okay, you can go ahead and stop. Can you tilt your head to one side, tilt your head to the other side? Okay, turn your head one side, turn your head to the other side. Okay, and how about turning your head all the way down? I guess that would be, what do you call that? When you go all the way down with your head. Yeah, I don't know. It escapes me right now, but, brain fog. Okay, and can you go ahead and move your head all the way back? I could have just said move. The word move is very generic, very vague. It works for that situation. Anyway, move forward, move back. Okay, everything good? You shrug your shoulders. Okay, everything's good there. Rotate the wrists. Everything's good there. Can you rotate your ankles for me? One and then the other. It'd be a little weird if you could do it at the same time. I don't really want to see that. Okay, very good. And can you lift one leg up? Okay, lift the other leg up. Not at the same time. All right, very good. And I've already seen you're able to bend at the waist. That's great. Can you bend to one side and then the other? Okay, that's excellent. I think that's really all I got for you. So you can go ahead and sit back down. So how is everything feeling? How does your examination feel? Okay, everything was pretty good. Wasn't any pain, any discomfort. Okay, I know we went a little quickly, but that's kind of the nature of this examination, is to see if you have had any tingles at all in this examination. Have you had any? I sure hope so. Okay, well, the big thing with tingle immunity is that either you A, take a break from ASMR. Shouldn't be watching it all the time. I know ASMR is amazing, but when you're consuming it for a long point of time, when you're consuming it a lot, all at one point, okay, you start to, wear down those tingle senses. And it's a good thing to take a break. Maybe go touch some grass. Touching grass is really good for you. And, just getting outside and whatnot, that's a good thing to do. I love ASMR. ASMR is amazing, but sometimes you need a break, okay? So if you do take regular breaks and it's still an issue, you might think about changing up your style, changing up your people. See other people. It's okay to see other people. It's fine. All of us would probably encourage you to see other people. Okay? It's not really that big of a deal for us. Okay? So that's a couple of good things to do. And another thing is look up different styles of videos. Sometimes unintentional ASMR does a lot more than intentional ASMR does. I know my boyfriend loves to watch people mowing lawns and repairing old tools and cleaning furniture and stuff at night. That's really weird to me. But then I started watching it and it hits a lot different than regular ASMR does. Sometimes you've just got to change up the style and maybe try different triggers, or if you're a roleplay kind of person, maybe try trigger videos instead. If you're a trigger video kind of person, try some roleplays. There's an abundance of things that you can do to try to treat your tingle immunity. Okay? Any questions for me? I know this is kind of a little fast, a little bit of a diatribe, but I think we've got that all together. So I'm going to go ahead and sign off on our examination, and we already talked about your treatment. So I want to see you back maybe a couple days or so, and we'll see how that goes. I would say if you took at least a solid couple days break from ASMR and then maybe tried something new that you've never tried before, that might be the sweet spot to hit that tingle game again, okay? We want a strong tingle game, all right? So thanks for coming in. I really hope that this helped and appreciate you having me here. So I hope you have a whale of a day and a good rest of your night. Thank you.